Ureterotomy with exploration or drainage. The physician makes an incision in the ureter and sometimes places fine traction sutures at the edges of the incision. The physician examines the interior of the ureter or, if the incision is for drainage, the physician inserts a catheter tip into the ureter and passes the tube through a stab incision in the skin of the flank. The physician sutures the incision and performs a layered closure. Ureterotomy for insertion of indwelling stent, all types. The physician makes an incision in the ureter and sometimes places fine traction sutures at the edges of the incision. The physician inserts a slender rod or catheter into the ureter, sutures the incision, and performs a layered closure. Ureterolithotomy, upper 1/3 of ureter. Middle 1/3 of ureter. Lower 1/3 of ureter. The physician makes an incision in the ureter, ureterotomy, to remove a stone, calculus, from the ureter. To access the ureter, the physician makes an incision in the skin and cuts the muscles, fat, and fibrous membranes, fascia, overlying the ureter. For the upper or middle third of the ureter, the physician usually makes an incision in the skin of the flank. To access the lower third of the ureter, the physician usually makes a curved lower quadrant incision. The physician isolates the calculus and removes it through an incision in the ureter. After examining the ureter for other defects, the physician sutures the incision and performs a layered closure, inserting a drain tube through a stab incision in the skin. Ureterotomy or ureterostomy, external, pendulous urethra. Perineal urethra, external. A longitudinal incision is made directly over the sound. After the stricture is identified, the urethra is incised the length of the stricture so defects may be removed. The sound is removed and a catheter is passed through the urethra into the area of the incision and guided past it into the bladder. The urethra is repaired over the catheter, using sutures. Occasionally, the urethra is not repaired by suturing but is simply allowed to grow epithelial cells, epithelialize, around the catheter. Ureteropielostomy, anastomosis of ureter and renal pelvis. The physician surgically connects the upper ureter and renal pelvis to allow for urinary drainage. To access the renal pelvis and ureter, the physician makes an incision in the skin of the flank, cuts the muscles, fat, and fascia overlying the kidney, and sometimes removes a portion of the 11th or 12th rib. The physician ligates the renal pelvis and ureter at the point of blockage. After excising the obstructing part of the ureter or pelvis, the physician surgically connects, anastomosis, the two structures, bypassing the obstructing point. To provide support during healing, the physician may insert a slender tube into the renal pelvis. After wrapping the anastomosis with perinephric fat, the physician inserts a drain tube and performs a layered closure.